clearly did fail, because we've got more cases in many areas of the country. We've got more cases of the Delta variant than we've ever had of any COVID variant at all. So it clearly failed. Now, there may be specific reasons, but it clearly failed. How can you possibly say that it didn't fail to stop the new variant spreading right across the country?
Well, what I'm saying, Chair, is that we have a comprehensive end-to-end system when it comes to managing health measures at the border, and the government has had a long-standing record and policy of managing health measures at the border, which is very, very well publicised and well aware. And on top of that, of course, we have the largest genomic sequencing capacity in the world, effectively, which has been able to spot these variants of concerns that have been coming into the country. And that has also helped to structure the way in which governments across the whole of government, I should emphasise, based on JBC, based on work with Department of Health, based on work with the Department of Transport, then that measures are then operationalised at the border through Border Force, but also upstreamed in terms of checks that carriers are undertaking.
But it clearly hasn't worked. And the reason this matters is because, given that it hasn't worked, we need to have confidence in what you're doing for the future, whether you're going to react quickly enough to any other new variants that might somehow threaten the vaccine programme. And if you won't even recognise that the system did fail on Delta, it's very hard to have confidence in it. Just one final question on this. NervTag said on the 16th of April that it was worried about India and that travel advice needed to be reviewed. You'd already seen a big soaring of cases, doubling every week in early April in India, and concerns being raised about potential new variants. Given that NervTag said that on the 16th of April, why did it take a full week until the 23rd of April for India to be put on the red list?
Well, first of all, Chair, it is entirely wrong to suggest that we delayed putting India on the red list, which is effectively the suggestion that's being made. There were other countries that were put on the red list, including Bangladesh and Pakistan, early in April, and that decision was taken on the basis of the positivity rate of people entering the country and the data that showed the proportion of people testing positive. So this does come back to effective measures where we were able to test people who were coming into the country was 3 times higher amongst people coming in from Pakistan than India. And of course, the date of the India red listing, the ban, was the 23rd of April, with everyone arriving from India then being put into quarantine in a hotel for 10 days. And that is also 5 days before the Delta variant was formally put under investigation on the 28th of April, and 2 weeks before it is labelled a variant of concern on the 7th of May. And even before India was red listed, everyone had to quarantine from red listed countries on arrival for 10 days, and also take a pre-departure test, take further tests on day 2, day 8, and that was in addition to the upstreaming of checks through carriers, and carriers were explicitly, there's a fine involved for carriers, which Transport have put in place, effectively, basically for carriers to help us and support with that 100% compliance checks that were undertaken. And it is important to recognise that it is the testing capability and the sequencing that has been able to identify variants of concern. Okay. And that is fundamental to government policy and will continue to be, as colleagues Matthew and Paul testify. Fine. And I would suggest, Chair, other colleagues across government would testify. You've spoken to JBC, if you speak to Department of Health and the capacity there, and Public Health England, these are all important component parts that come together to demonstrate the
we need to move on to another
that is taking place when it comes to the end-to-end border policy.
Unfortunately, Home Secretary, I don't think there's anybody in the country who thinks that your border policy worked to prevent the Delta variant spreading right across the country, and we can see the evidence. And so it's therefore quite troubling that you're effectively saying the policy did work and isn't being changed in order to react more swiftly. But we need to move